Where is it? Here we go. Great. Thanks. Happy Friday, everyone. Thanks for joining Think Kids to learn more about West Virginia 211. I'm Kelly Caseman, the Executive Director of Think Kids. And those of you watching in real time on our YouTube channel, you're welcome to share your questions or comments in the comments section, and we will get to them as the conversation progresses. Let's meet our panelists. Margaret O'Neill is the president of the United Way of Central West Virginia, and April Knight is the state director of West Virginia 211. Welcome to you both.
Thanks, Kelly.
Yeah, thanks for joining us on a Friday afternoon. Let's start with something folks probably already know, but just in case they don't, what is the United Way? What are you? What do you do? And where are you located?
It's so funny because we sometimes say, I have my name tag on and somebody will be in an elevator and they go, oh gosh, I love the United Way. And I'm like, great, what do you love? And they're like, well, I know I love something. And so I appreciate the question because sometimes that is the fact. And so our United Way is United Way of Central West Virginia. We are located in Charleston, and we are very grateful to serve 6 Central West Virginia counties. So really the heart of West Virginia: Kanawha, Putnam, Boone, Logan, Clay, and Braxton. And by serve, that's exactly what we try to do. We fund nonprofit programs across our footprint. So about 35 different programs receive funding from our United Way every month to support things that we think are super important for families and people to really have a whole and full life. And those include education, healthcare, financial stability, and then the safety nets that we always worried about, but probably worry about now more than ever, which include our shelters, both domestic violence and homeless, child advocacy centers, Salvation Army, Red Cross, et cetera. So we try to do both outside work with our funded partners and then internal initiatives, sometimes to fill gaps that we see, or sometimes because it's just a process that the United Way can serve. So we try to do a lot, and you can know that there are 12 United Ways in West Virginia, and we're very fortunate to be the one here in Charleston.
Great. That's what I was going to ask. So you have a national footprint, but you're also very local, right?
Right. So, we have the autonomy of doing what's outside our window. And fortunately, those windows look different in Boone County versus Clay versus Charleston, or even Eastern Kanawha versus, the capital city. So we can program differently to each of those areas. And, if we know there's a section that really has food insecurity, we can focus on feeding and nutrition in those communities versus a city, sometimes a bigger city like Charleston, where homelessness may be a concern or a topic that we really need to focus on. We have the autonomy to do that. So the most recognized nonprofit brand in the world because of that national and international footprint, but also very local and very autonomous here in our community.
Great, thanks. So that's a good segue. How does 211 fit into that mission?
You want me to start, April, and then you kind of we can join forces on this one. So 211 was a product of the United Way worldwide. So years ago in the early 2000s, people met in Washington, D.C., and the concern was originally around disaster and the fact that people really needed a number like 911 and 411 to be able to take the burden off of those emergency management systems when there was something like flooding or unfortunately hurricanes like we have today or others. And so 211 was created at a national level, and then every state was asked to come back in their legislative body and make that their state number. So 211 is our West Virginia information and referral number across the state, and there is a 211 in every state in the country, and it's very similar. So our goal was to try to make that experience similar to you if you're here in West Virginia, or if you have family in Tennessee, that they have a very similar 211 experience. And so over time, the United Ways kind of weaved in and out on the West Virginia level. But in 2018, our United Ways formed a collaborative and statewide took over governance of West Virginia 211. And since then have tried really hard to sustain it, make it, the best that it can possibly be. And part of that was to find the perfect person to be the state director and really lead us forward as we go through the next decade. And I couldn't be more pleased to tell you that April Knight is that person. So we're very grateful to have April on our team.
Well, thank you, Margaret. And I'm very fortunate to work for 211. I can't thank the United Way enough for what they've done to get this ball rolling, to keep us sustained as long as they have so far. We're improving every day. We're improving our staffing all the time. Our database is getting looked at every day and getting corrected and improved and added to. We fit really well with United Way because we are located in each of the United Way offices throughout the state. And that's helpful to us because sometimes if a person comes to the office looking for a need, they have a live person they can speak with that can help them. And sometimes United Way themselves might be able to offer a service that 211 doesn't offer. And so that's very, very helpful for the people in need.
Great, thanks. So to recap, 211 has been around in the state for quite a while. It's not been under, I could be wrong, it's not been under the United Way's umbrella the whole time, but now there is really kind of a concerted effort to bring April on, really kind of make it more comprehensive strategy, be able to respond to the need as community need grows.
Absolutely. And I think what April said that we've really tried to focus on is if that 211 specialist answers a call and it's a need that they know is an urgent or emergent need, and that they can't find the perfect resource in the database, that they have the ability to literally walk across the hall to their United Way counterpart and say, there are children in this home, or, this is a situation that we really need to try to solve or find a solution to. And two things happen. Sometimes the United Way is able to meet that need, but it also gives us a chance to start to identify unmet needs. And you and I've talked about this before, to us in United Way land, that's almost as important as being able to meet the needs through our resources in 211, because when we identify those gaps, we can have those conversations internally as United Ways and how we can address or fill those gaps, or we can look at funded partners that we already know and trust that, that we've worked with in our communities that may be a better fit to fill the gap in the moment. But it really is a nice marriage between the 211 services and United Way services that we can provide. And at the end of the day, we just want to be your resource of resources. If that takes both of us together, or if that's individually through a phone call to 211.
Great, thanks for that. I have another question, but I'm going to ask it after I ask this one, because this will kind of delve into the weeds, so to speak. I'd like to talk a bit about where we are in West Virginia in this shared space of continuing to address abject poverty and the consequences of the ongoing drug epidemic. It's taken a real toll on our community resources. Can you share your thoughts on how community and family need for services has changed over the last 10, 15 years?
April's probably seen those changes from a different lens in her previous work, as she is now at 211. So I'll let her talk about that in a second. For us as United Ways and 211, we thought we had seen the worst of what could happen 10 or 12 years ago. I can tell you that I did not anticipate the level of abuse and neglect and challenges that we're seeing in 2022. And so we were starting to see those increased challenges, I think, in 2019, and really starting to remember that there was still a substance use disorder epidemic and that it had morphed into some other things, and that we needed to pay attention to that. And then COVID came. And so everything kind of shifted into that emergency COVID place. And then as we start to come out of that, we see that not only were we right that 2019 was becoming a critical point, but COVID just escalated that as well. So, I think for United Way perspective, and as April can tell you, as the increased number of calls that we're seeing through 211, and many of them with children in the home, right? So eviction notifications, and I have 2 children. Our operators have literally been on the phone with families as they are removed from a home due to eviction, begging for help and assistance. And so our operators have heard, some pretty tragic stories in the last couple of years. And part of that has been just the add-on that COVID, that last straw, I guess is what I'm trying to say, kind of broke the camel's back, right? People were on the edge, on the cliff is what we talk about a lot. And COVID just pushed some families right off the cliff. And many of them have children, and many of them were either in recovery or seeking recovery opportunities. That was delayed on occasion. And so the challenges have, I think without question, we've seen an escalation of people who need additional support through all of that because of an addiction problem of their own, or because that they're raising or helping raise children due to the addiction epidemic in their family. So we've seen a big increase.
Yes, and when I look at our reports every month, the calls just keep increasing. For the past 3 years, our calls have increased by quite a substantial margin. In the last year, we took over 31,000 contacts from help seekers, and we're on track to exceed that by a good margin this year again. The number one need that we're seeing from families is help with utilities and also rent assistance. But now it seems the calls are turning more and more toward resources to help prevent homelessness or to address those needs. And I believe that some of the major, COVID-funded resources that are now going away, it's going to be a tougher need to fill because the available funding out there is decreasing. Right.
No, exactly. And so we did see that, kind of a flurry of organizations who wanted to help support, eviction and utility assistance. And as we see that start to go away from the federal level and also from some other state and municipality level, it is going to become a bigger challenge. And we don't have enough safe and affordable housing in West Virginia. And so that escalates the problem as well.
That's so important. I'm going to try and articulate something that's hard when a camera's not on me to articulate, but I'm going to give it a whirl. So it seems as if, especially when we're talking about the unmet needs of people affected by the drug epidemic, we've talked about abject poverty in West Virginia historically. So it's something that's been on all of our radars for a mighty long time. But when we start talking about meeting the needs of kids and families who are affected by it, it can be very difficult. It can become very fuzzy as to where the resources are, the capacity of the resources. And I think one of the ways that we don't talk about what 211 and the United Way can do, but it's very important, is that you have data that can show and prioritize what people are calling for and what that need is, because we've gotten to the point where we know that the need is too big for any kind of just one response. It's going to take a strategic response and to strategically put funding in particular places. And you all do have that data to show, here's where people, when they contact us, here's what is, a specific need in this moment.
Well, and if I might add to that, we launched a new tool recently called 211 Counts. If you go to the website, 211counts.org, you can click on the state of West Virginia, and we've uploaded all of our data since May of last year. So now we have more than a year's worth of data on that website. You can sort that data any which way you like to suit your needs. You can search by the zip code level, county level, congressional district, school district, regions, and it's sorted by the top 10 basic needs categories, which include housing, food, medical care, things like that. You can look at demographics of the callers who've been calling for each of those needs and see the exact number of calls per area. And any need that you click on that website, if you look in the lower right-hand corner, it's going to show you a chart of the past year of the call volume for that need. And every single one shows a trend line of upward. There is no need that has turned down that I can find.
What was the website again?
211counts.org.
Yep. And so you can compare that to other states. You can look at West Virginia, but that is really close to real-time data. And so if people are interested in, what's happening in my community, what's happening in my United Way community, I love that we can drill down into congressional districts and other areas of, someone else that could be an advocate for the people that we serve. And so, yep, it's perfect. Kelly's on it. And so you can actually take a deep dive into what's happening in West Virginia. And we love that because sometimes we hear, well, that can't be right. that many people can't have called, or are you sure that they're hungry? And, for us, this is just super cool data, and it gives us a really good chance to see some other things like where we may need to do additional marketing. So if we look at this map and we see some counties are low in calls, is that because it's a more rural community and just a lower population that would be callers? Or is it because we haven't done enough to let people know that 211 is a resource in their community? So we're using this data for a lot of different reasons. But for people who have found out about 211 or are just really curious, it's a great tool for you to kind of explore and find out more about your particular community. We love it.
Yes.
I can see this being really helpful in a number of ways. One of them, of course, for those resource providers who need data, right? So that is really helpful. So give me just a sec so I can stop sharing. Okay, there we go. So we'll put a link to that after we're done the video this afternoon. So my next question is that it's been my experience, something that we talk about a lot at Think Kids, and Margaret, I'm sure that we've talked about over the last year or two, because we think addressing the unmet needs of kids affected by poverty, but affected by the drug epidemic as well, is the #1 priority. And sometimes people do not know where resources are. So that is one of the things when we held focus groups a couple of years ago. People would be so upset that there weren't any resources in their community. And we started asking, how do you know there aren't resources in your community? And it may be perhaps they, it's fatalism. They didn't look, or they didn't know where to look. But often we just don't know where things are. And so how can we prioritize resources if we're not evaluating where the gaps are, if we don't know where the gaps are? So what are your thoughts on this?
April, you want to go first? You want?
Sure. Well, I think that a big part of that is, like you just showed, using that map on 211counts.org. It shows you very easily visually where the hotspots are and where we don't get very many calls. And so those are areas that we do need to look at and make sure why callers aren't coming in from those areas. And that's something that we will be looking at. But yeah, we can run reports and find out exactly where people are connecting with resources and where they're not. We can show the unmet needs in those geographic areas over time also.
And I think, part of what we sometimes forget is that if a family's in crisis or a person is in crisis, and we have expectation that they should reach out on their own and that they should do this research and try to find stuff, that sometimes that's a high expectation for families. And that if they're just trying to figure out how they're going to get their kid picked up from school or how they're going to get their, food for the weekend or whatever that is, saying to them, go do your research and figure out who to call might be just a little bit too much for some families at some point in their situation. And so that's why we just, every breath we take, I know it sounds crazy, but I swear, no matter who we're talking to, at the end of the day, we talk about 211 because that is the easiest, simplest way for people to reach out and find out what's closest to them. So if you're watching this and it's new to you and 211's like, oh my gosh, I never heard of that before. It's very zip code driven. And so when you call or you text or you use our chat feature on the website, you're always going to be asked right away what your zip code is, because that's how we can direct you to the resources closest to you. So, and that's super important. So we are always trying to share with people that's the easiest place to find your resources. And then in addition to that, we as a team, and April and her team of specialists, are focused every day on making sure those resources we give you are accurate. So that's the other piece. If somebody calls 211 or they called 10 years ago or they called another resource or they had a paper guide that somebody gave them, and Kelly and I can do this is how long a paper guide lasts, right there. So if somebody gives you a piece of paper, that's how long it's good for, because before we end the call today, something will have closed or their hours will have changed. And so for our team, it's equally important that we're referring you to resources that are true and that are open and that will have some assistance that you are seeking. So why 211 hasn't worked well before and in other places is because it's been one or the other. Yes, there's access to the number, but when you get the number, the resources aren't great. Or yes, the resources are okay, but you don't have access to where to, find the people. So the beauty of our 211 here in West Virginia, where we're growing to, is that it's both. You have easy access. You can text it, you can call it, you can go to the chat and just put in a chat, and that it works 24/7, 365. So if it's, we were just talking about this, we're going to be doing some marketing in the fall, because we know holiday seasons are really hard for people. Don't know where to get a food basket, don't know how to get presents for your kids, depression, et cetera, et cetera. And so putting marketing pieces out in all these communities just to remind people that that is a safe, confidential, really good resource for people to reach out to no matter what your struggle is. And that sometimes when we talk about you called because your utilities are disconnected, the root cause of that is something else. Right. And so those operators, call specialists, are trained to try to help get to the root cause. So not only may we be able to give you resources to help your utility bill, but we may be able to help give you resources so that you don't have that same struggle month after month.
It's a great point. I can't tell you how many times over the years, and I was guilty of this too until a couple of years ago, where, I would have a teacher call me or a healthcare provider call me and say, I have this child in this situation and she needs help. And I have looked high and low, and I'm trying to find all this stuff to help them. And they've spent hours of their time, doing essential, what is care coordination, right? They're doing the work of a social worker. And, with the point that we tried to make to them is, somebody's already done this work. So go to 211 and, you can focus more time on what you can do for the child than, trying to fund all these resources in your community, which can be very hard. And this is actually something I spoke to during an interim meeting of the legislature, is that, even our state government sites have outdated information. People don't realize that they're putting outdated information. So these people who are in desperate need of help go through that scavenger hunt. They do the Googling, they try and find this information, and it can become so difficult and frustrating when you keep finding resources that just aren't there anymore. And if we are fortunate to have teachers working with providers and they're trying to help families and they're going to the same source for accurate information, they can really work in a more coordinated way. And so there's so many ways that they can use 211, but one of them is, it's that validated information. You're not going to get that someplace else.
Absolutely. And for us, it all works together, right? So then that builds correct data, because those, if it's the teachers or families or, people are calling on behalf of clients, it helps us build the data that we're providing resources to that. It helps us identify any of those unmet needs, and it provides an easy resource to families or those worker bees trying to help families to get those resources. And we have conversations every day with, how can we do that better? Do we work with somebody like Aetna who has, specific membership, and how do we make sure that the members know that they are utilizing all of the resources provided to them by Aetna or Humana, or, fill in the blank. And so those are conversations that we're having ongoing about, can we expand 211 to some type of navigator that can really help drill down into those services. And so this is going to get nothing but better as time goes on, and more opportunity for people to reach out and get help and get services. But helping us get the word out, things like what you're doing today, Kelly, and what you've done for 211 over the last couple of years are, that's why our partners are so valuable. And Think Kids is one of those great partners. But this is how we build it up, is making sure people know that they can call. There's no judgment. There's no stigma. We ask a few demographic questions because it really helps us, again, understand our community needs and where they are and what they are. And most people are very, kind enough to answer those demographic questions for us to help build that information. But we want to make sure that if somebody is in distress, that we don't add to it, and that our operators are able to calm them, first of all, and not be irritated back at them, and not mirror that challenge on the other end, but to simply calm them and say, we're going to do everything we can to help you. And if you don't find help in these three options, call us back, right? Call us back, and we're going to try to find three more. And it may be a little further from your zip code, but it may be the resource that you need. So you all helping spread the word is a huge part of our work.
Well, you touched on something, April, please go ahead.
I was just going to say, absolutely, I agree. And we do want people like teachers, nurses, social workers to know they can reach out to us anytime on behalf of any of their clients. This is, we're here to serve everybody. And if they don't want to make that phone call, they can still go to our website and search the resources themselves. That's an available service that we also provide for free to anyone who needs it.
Yeah, the point I wanted to make is that, sometimes people don't have great experiences finding resources or working with different organizations. And so it can be very stigmatizing. It can be very judgmental, and just that one time of having that moment, it can really, stop them from reaching out and getting the help when they need it. And so, knowing that they can go to a source that is going to be non-judgmental, to be helpful to them. I mean, I think that building that trust with an organization can be really difficult. And we talk about that a lot in the work that we do is, if there's one teacher that has really built a great relationship with a family, they are really in a unique position to say, here's a great resource for you to try, because they trust them. And so I think it's really important to not just tell families about 211, but to really let those helpers know where those resources are too. And they can, if they want to do their Googling, which, makes them feel good, they can do their research on 211 and then see who's in that community. And then, if we get to know, a lot of our communities are rather small. And if you get to know who's providing those resources in the community, you can really start working together for some really important things to meet the gaps that you find there. So the next question is, which we may have covered, but we can talk about it again. How can we help people get better connected with 211?
I'm going to take part of this, April, and then you add to it because it's fresh in my mind because it's happening today. So we have a local daycare provider here in the Charleston community that has a challenging population and really trying to direct resources to her families. And I think maybe this is a place where I can interject. Sometimes we assume people have a way to access those resources when they don't. So sometimes people don't have a phone. Sometimes they don't have access to a computer or to internet services. So when we're saying, well, you should know that, or you should be able to do that, we're sometimes expecting things that people can't do. And so as we talked to this daycare provider, it became clear that we needed to take 211 to them. And so in this particular case, how we're meeting that need is it's 211 day at this daycare provider. And so the resources, and that's from the United Way side of the house, right? So our team will be going, but we are going with, we know what 211 has. We can access the database. We can make referrals if they need utility or rental assistance. We can get food on the spot if that's the concern that they have at this particular moment. And so sometimes 211 has to go on the road and be present in places where we have a group of people who have a need and may be challenged with access to transportation or to internet or broadband, and we need to go to them. That's something that we're figuring out from the United Way side of the house, and that our 211 specialist or our community impact team will be making some face-to-face visits where people can actually talk to somebody, face-to-face, and then access those resources and literally just be handed a piece of paper that says, here's who's going to be able to pay your bill, or here's 3 people who are going to be able to join together to pay your bill and be able to get you connected. And then while we have you here, is there a financial stability piece that we need to talk about? Are you going to, do you have a bank account? Are we making sure that you got your stimulus and your child tax credits? And what else can we do now that we have, again, hopefully started a relationship, started to build some trust with these families, that even if 211 day isn't tomorrow, that they may have enough confidence to reach out to us at that point and say, I met you last Friday and here it is next Friday, and I still don't have enough food, or I still need some other assistance, that they'll be able to kind of put a name and a face together to make that happen. So that's one way we are trying to make 211 available. And then April can tell you, the show has been on the road for the last couple of months. We've been anywhere anybody will sit and listen.
Absolutely. And this happens with all of our people all across the state. We try to be involved in our communities in many ways. And like you said, going to organizations one-on-one, making sure that anyone who wants printed information about 211 has it available to give out to their staff and their clients. We also have a Facebook page, and I would invite everybody to like us. And if you find one of our posts helpful, please share it and help get the word out about things like that. So yeah, we're here to try to help spread the word and make awareness about 211, because we have to do a better job of getting that awareness out to the public.
Well, I think one of the biggest problems is people don't think about it until they need it, or they know somebody who needs it. And so just having it on handy for when somebody does, I think is really important. And, Margaret, you and I have talked a little bit about sometimes daycare centers or schools, they find themselves in real dire straits, and they need more resources than are available to some families that are really going through some difficult times. And so it's great that you all can wrap yourselves kind of around, an organization like that and really help them. I have no doubt, and I'm sure you don't either, that there are probably more childcare facilities and schools and other areas around the state who are in the same situation. And so, but we don't know who they are or where they are until they reach out in some capacity. And so,
right, we want to, we believe wholeheartedly here that it's our job to meet people where they are. And so, if they call, that meeting happens a little quicker, but it's also up to us to find people. And so you're exactly right that, there's one daycare that I have in my head today, but there are 100 more that are experiencing similar things. I can tell you the relationships we're building with the communities and schools have been really helpful, because those counselors are aware of 211, and we speak to them in their training, and so they know that that's a resource they can use right away. But we welcome, if you are watching and you're like, oh my gosh, we wish that April would come and just talk to our counselors for 10 minutes on a day that you're having training at your school, any of us will divide and conquer and do that. So it's yes to the general public, we need to do better to spread the word, but we've got a bunch of people that are touching families and children every day that still don't know about 211. And I was with one of those, a mental health professional yesterday, and I said, I want to make sure you know about 211. She was like, great, what's that? And she's worked in mental health for 9 years in Charleston. And so, we think we're doing good. But at the end of the day, I think we've still just reached a very small percentage of the people in West Virginia that can access this service. And so it's up to us to really keep our feet on the ground and keep, making sure that every person we talk to. And I'll give you a quick story about why that's so important. So we had spoken to a group of Head Start professionals in West Virginia. And one of the ladies was in Monroe County. And when we finished, she said, Margaret, I just need to tell you a story. You had talked to me about 211 before. Actually, her call specialist in Greenbrier County had been to a Head Start meeting and shared 211 with them. And her daughter lives in North Dakota. And she said, I'm at home one evening. My daughter calls and she's like, Mom, there's a person who works with me and she's expressing suicidal thoughts and I don't know what to do and you got to help me. And this woman is a professional, right? I mean, she's a professional counselor, works for Head Start, and she was going through do you know her mom? Can you call somebody in her family? And every answer was no. And so the lady finally said, can you call 211? Every state has a 211. And so this young girl in North Dakota picks up the phone and calls 211 for her friend, who then received free counseling, was connected to some suicidal support systems in that state. And so when we're talking to people, you never know when you're going to be the one somebody comes to, right? When you're sitting in church on Sunday, or where you're in the grocery store or Starbucks and somebody says, oh my gosh, my sister, my cousin, my family, my neighbor needs something. And all you have to remember, that's all you got to remember. You don't have to remember who provides the resources. All you got to remember is every state has a 211, including West Virginia. And if you get them that far, we're going to try to handhold them through whatever else it is that they need. So you just got to remember 3 numbers.
That's so important, because you never know. This is something I've really learned, that you never really know what resources are in a community. You may assume because it's a small population, or they don't have a lot of resources, they don't have a large tax base, they don't have resources. But Clay County is a wonderful example, because they have school-based health centers, for example, that have a child psychiatrist who comes to them. You don't know unless you really check to see what resources are there. And I I am still kind of dumbfounded when I go into some counties and I talk to folks, I'll talk to the social workers in the schools and they've never heard of 211. But then I go to, I was in Martinsburg a few weeks ago and I was talking with the Martinsburg Initiative and they were like, oh yeah, we all know about 211. We meet with United Way. Like they really get that, staying connected, especially when we know that we're not always a resource rich state, that it really takes that collaborative effort to find the gaps and then collectively seeing what you can do about them. And so, 211, I think, is really like step one. Take this, make this call, and then that will start you on your journey to really finding those resources.
Yep.
So I know that we all three are on the same page of that. We'll share some links after the call. Like I said before, I want to pivot just for a minute and ask about United for Alice. So we talked a little bit about that campaign a few months ago. What is it and how is it going?
Gosh, I've grown to love Alice so much, and I really didn't think I would. At the beginning, I wasn't sure I was going to love her, but Alice, the Alice Project, as we refer to it here in West Virginia, Alice is an acronym. So it stands for Asset Limited, Income Constrained, Employed. And so these are folks that we know and see and tip and wait with every day. So, we challenge people to look out into their world and open your eyes to who is an Alice person or an Alice family. And it's folks that we, over time, I'll be 62 next year. And I think we've referred to folks as the working poor way too long, and the stigma that's attached to that. And so working is working. And if you're working hard, you're working hard. And I don't know about you all, but I don't get to dictate how much they pay me, right? And so you just know you need a job and you need to be able to feed your kids and take care of your family. And so Alice households in West Virginia are struggling, and they were struggling before COVID. But what we know is that they were also many families on the cliff, on the brink of having some kind of a personal disaster within their household. And then COVID just shoved a bunch of people off the cliff because they were unable to work for X number of weeks or months, or somebody experienced serious illness due to COVID or death due to COVID, or their caregiver. And so, the struggle was real for families in West Virginia. And if you count Alice families, so the folks that are just above the federal poverty line, these are folks who we say, do you have a working budget? Do you make enough to just pay your rent, pay your car payment, have a little insurance, have a cell phone bill? There's very little savings involved in the Alice budget, really nothing for higher education or those kinds of things. And when we started to look at that, there were people that worked for United Ways, right? And so the first thing we had to do was look internally and say, are we paying our people enough? Do we have Alice? Do we need to take care of these Alice families that are our families? And then after that, look out into the world and say, how can we help encourage folks that are working 2 jobs, or moms and dads or partners that are working 2 or 3 jobs, just trying to make ends meet, and call attention to those families and their struggle and what we can do to help them. And so Alice is alive and well. We're going to have some updated information in early 23 that'll be through 2021 and really give us an idea of their struggle.
Oh, I'm sorry, Margaret. I know I have a cold too, and I have moments of coughing, so I totally get it. And again, that website, and we'll share it. We'll share the link. Has a lot of information that is really helpful, particularly if you're a grant maker or grant writer, because it can really help you articulate the struggle of this population that needs additional resources, as you said, to help ends meet. And we have this tendency to say, to think that if somebody has a job, then they can meet certain needs. And it's kind of surprising to me how often I'll watch, a TV show who will say, they'll say things like, we'll just save $200 from every paycheck and that's easy for some people, but that's not going to help people really, address their unmet needs in this moment. And so having that information and really elevating the plight of this population is really important.
So this is exciting. Last night on Wheel of Fortune, they're doing Wheel of Fortune celebrities for charity. And Tiki Barber, who was national football player, played for United for Alice, was his charity of choice. And so as we start to see nationally, people call attention to these families that have been, they're the ones that we can move forward the quickest, right? Because they theoretically know how to pay a bill. They already have a job. You know, they're doing everything everybody's asked them to do. So how can we advocate for them? And it may be a different way. And so, you know, you've heard me say and others, this is not a policy driven piece of data. It's facts. It's just facts about citizens in West Virginia. But what if we can advocate for those families and say, if the SNAP benefit level was just $2,000 more a year, could that keep 5,000 women in the workplace because they could still work and keep their child care or their SNAP benefit? So it's a way to look through a different lens, not a lot different than DEI work, right? Just really being focused in on a particular group and how we can impact them the best and the quickest fashion to move them forward, however they need to move forward. And sometimes that's a gas card, honestly, because my struggle with gas prices is we're working 2 jobs, but it's a long way and I can't move because all my support is here. But if I could get a $50 gas card a month, man, I am golden. And so those are the things that we're looking at for our Alice families, and then for funders to be able to come back to the table and say, you know, I want to give you $10,000 specifically for Alice families. And so when those callers come through 211 and then they get pushed over to the United Way side because they're identified as that Alice family, we have a little pot of money that we can use to service them and to help them, you know, again, past whatever that initial crisis is, and then maybe have the conversation about higher education or another training opportunity, or is there a class you could take that would move you up $2 on the pay scale in your company? And so those are the things that Alice brings to the table, conversations about specific demographics. We know that women, single female-headed households with children in West Virginia, that 80% of them are Alice families. And so that explains a lot when you're talking about daycare and childcare and trying to find resources. We know that 71% of 25-year-olds or less in West Virginia are Alice. And so we know we need to focus some programming into high school to say, what's your plan? Doesn't have to be college, but we have to talk about a plan because we have a lot of 22 and 23-year-olds that are really struggling in poverty right now. And we don't want that to be you. So how can we bring mentors to them, or how can we bring job coaches to them? And so that's the kind of programming that Alice is going to lead us to. And we're excited to get the refresh early next year and really share with people what COVID challenges have happened to Alice since then. But if that's a program all on its own and a much longer conversation. But if you'd like more information about that, please reach out to us. Businesses especially have taken a great interest in Alice, as I think all of us are trying to take care of our people now more than ever and keep our good people working for us. This is a super important conversation.
I love the fact that you said we first looked internally. So how many Alice's do we have in-house and what can we do to help them? I think if we just had more businesses that did that, that would be a wonderful first step in addressing those needs.
Thanks. Because we had people look at the budget. We had people look at the budget and say, can you live on that? We have a single mom here with an 11-year-old. I have a 62-year-old single person. And I'm like, that's what's important to us, right? If we can't take care internally of our people, how can I take care of people out there? And so, I think if all of us as companies and businesses did that, half the battle was won, right?
Right. That's a wonderful point. Before I jump on, April, did you have anything to add? I feel like I jumped in when you may have wanted to say something.
Oh, no. Margaret does a great job speaking about Alice. I think the only thing I would add is that we can tell from 211 data that about 75% of the people I'm sorry, I'm looking at the wrong statistic. 93% of our callers are Alice households.
Now, see, that's news to me, but yikes, right? And so that's that marriage. That's that, again, that we know we're doing the right thing because we're working to serve the same population. And so that's just crazy sauce right there. But that's a really good snapshot of the challenges that Alice faces, because they are that person looking for this is the last day of the month. So April can tell you this week has been especially busy because people start to run out of money right before the end of the month. And so that's where we see those calls for food insecurity from seniors. It's been a while since I got my Social Security check. Can I get a box of food just to tide me over till the next check comes? And so it's really interesting, April. 93%, is that what you said?
Yes. Mm-hmm.
Wow. Yeah. So we talk a lot. I hear a lot from policymakers who say, we need to invest in our kids. Well, if we're going to invest in our kids, we need to invest in Alice, right? Because Alice is raising those children. And so we need to make sure that they have a healthy upbringing. I'm going to ask such a loaded, long question. So forgive me, but it's an important question. How can we do more as a state and community to help address social determinants of health?
Boy, that is a loaded question. And, depends on who watches this, how much hate mail I'll get, right? So don't tweet me. Part of what I would say about that is it's one thing to talk about the social determinants and it's another thing to do something about it. And so we can't just pinpoint it as, oh gosh, that's a way to identify people, because it surely is. But once you identify them, you got to know what to do with them, right? And so if we're talking to healthcare professionals or hospitals or, whomever is trying to help identify those determinants, and somebody says, first of all, you can't say, do you have food insecurity? Because some of them aren't going to know what you talk about, right? So it has to be, what's for dinner tonight? Or, are you going to be okay next week for lunches? And then if they say no, that there has to be that easy way to connect them to the resource they just told you they need, right? And so as we continue to work through paths with WVU Hospital, who uses Epic as their medical record, we have a way to marry their Epic app to our 211 data, so that if that person expresses food insecurity or I don't have money for lunch next week, that provider can connect them to 211 data. So if we can work towards that with all providers, right, with all healthcare professionals in West Virginia, the first thing would be they have to hear us, because I bet if you surveyed them on who knows about 211, it would be a very low percentage of them who would be able to give you that resource. And then we have to figure out, so once we find a way to share with them that we have resources, then a way for them to do more than just ask the question, but then give the answer, right? Here's the resource. And if you don't have time to do it, then we have to figure out a way to make that easy connection back to 211. So we do have the time to do it, and our operators are trained to do that. But if we could connect more people earlier, so that's what when we see people sometimes on our end, I'll never forget, it's been this summer, but a man called and said, I called 211, he said, I haven't eaten in 9 days. Well, we waited too long, right? We should have found him somewhere. Somebody could have found him quicker, we think. And so where was that person, or who was that organization that maybe didn't ask the question or didn't give that person a chance to express that he hadn't eaten in 9 days? And so, it's not just asking the question, it's then connecting them to the resource if they express that need to you. And I think that's the part we don't do very well. And I don't mean me like 211 always, but I think as a group of professionals that we sometimes miss that piece of connecting them back.
I agree. Yeah, it's I feel as if we have so many siloed systems. And so sometimes where I find my frustration is that we see a system trying to address a particular social determinant like food insecurity without connecting with the resource that's already doing it in the community. So, you can actually help sustain somebody who's already doing it in your community by connecting with them rather than competing with them to address, because we have so much need. It just makes more sense to try and do this as a collaborative approach rather than everybody siloed.
Yep. So this daycare, we talked to is talking about baby food and making baby food and all this. And we said yesterday, are you a member of Mountaineer Food Bank? Because you could potentially set up a little food pantry, inside your facility and have resources right there for your families. And so I and Kelly and I have talked about this before. We both believe, I think, not speaking for you, that we have a lot of the resources we need. It's just people don't know about them, or they don't want to, for whatever reason. We do get in our own little silo, and we don't always like to make that referral or partner with somebody else. And this is not about competition. Community development leads to economic development. And if we all can work together to make our communities better, and our people not hungry, and our citizens not seeking substance for whatever reason, and we get to the root cause, which I will forever believe is poverty until somebody proves me different, that until we can get to those folks, we're not marrying the need with the service. I can find just about anything, right? We're your resource of resources. We can find just about anything if you find us, And so it's just making the connection, and then no competition, just trying to help people. And at the end of the day, all of us win. Everybody wins. West Virginia wins. More people come here, live here, and raise their families here because we all work together to do the best thing for our kids and our families. So I agree. I think we have a lot of services. I don't always think we talk to each other. And I know not, because as I said, that little girl I talked to yesterday has been in mental health for 7 years and didn't know about 211. So that's distressing, right? We're like, where else can we stand from the rooftops and sing the song and share the message? And we're going to have a jingle. So you are going to get to sing the message, and everybody's going to hate us because it's a really catchy jingle and it's going to get stuck in your head. But get ready for that. It's coming in the fall.
Well, good. We'll make sure and sing it loud and proud with you, Margaret. So we only have a few minutes left. So an important question: what more can we do to support the United Way?
Well, I'm always going to say money, because that's just what we need. People ask me all the time how you do that, and we can't do it without money. We didn't buy that $800 worth of baby food yesterday without a donor saying, I care about babies and here's some money to do that. But aside from that, you can just tell the story, right? And so if somebody, and I say this to church deacons all the time, right? People in their church call the deacons and say, I need help with my utility bill. And many churches will take that on. And so what we try to say to people is have them call us first. Have them call us first. And if we can't help them, then we'll send them back to you. But if we work together, we're going to help more people and we're going to save money in the long run. So for the United Way, it's the same thing. Just tell people we're here and that we are your resource of resources, and that we're doing everything we can to work on the challenges that families see, especially people with children. And the real serious needs that children have right now, and how we can be an advocate for them, and how we can be a voice for some of the people who don't have a strong enough voice right now to tell people what they need. And, if that's an Alice family that we can talk about and say, they're working 3 jobs and they're doing every single thing they can, there has to be something on our end of society to help them. What is that, and how can we put people together to make that happen? Or if it's sending people to 211 to say, here are your resources, or if it's telling people about my free taxes and that they can, get their taxes done for free at a certain income level, and then have that conversation about what are you going to do with your return? Let's think about paying a bill ahead, or putting $100 in a savings account, or all of those conversations happen within and because of the United Way. And I tell people all the time, if your community didn't have one, you'd be figuring out how to start one, because you'd be missing a big piece of services in your community. So our United Way is, we're just honored to be a part of the tons of good work and great community partners in Central West Virginia. But we really want to do more, and people have to find us. So you tell your story and let people know the United Way is here. Thanks for asking.
Thanks, Margaret. And this is for, a whole other YouTube, but, it's another frustration to me when people immediately call a church, not because I don't think it's wrong to call a church, but because so much of our faith-based community has responded to the needs of those affected by poverty and the drug epidemic. And they have really been our go-to, but there are things that they wind up paying for or doing that are already being covered by federal funding, state funding, because they just don't know. And so they provide it. And so I think calling 211 first really gets you to understand, here's a federal program you qualify for, a state program, here's what's out there. And then if there's something that you still need, then go to your church.
Yeah, and I tell the church folks, and I mean this with love, but sometimes people lie. And I know you probably never heard that before, and probably nobody ever on here has ever heard that before. But sometimes they can be a little bit more misleading to somebody in their church family than they're going to be to us, because we know what you just said. I know what services are out there. I know where those funds can come from. And we're going to start with that, right? Do you get SNAP? Have you reached out to this one? And by the time we get to the end of it, we figured out how much we can do and help to make sure they're whole. Somebody that's just led to do those things within their faith-based community sometimes don't even know to ask questions. And so we duplicate services, right? And so we try to avoid that. And if you go to the root cause, That's what we want to get to. So yeah, I want to try to help you pay your bill so you can stay in your house. But what else do we need to do to help you so that you don't have to have help as often or as much as you did this month? And that's sometimes hard for somebody within your faith or your church or that knows you well and that you want to have dinner with on Sunday. Really hard to have those personal conversations with. So that's why I encourage you, again, you're confidential and no judgment. So the 211 piece is, we're not going to go like, what do you mean you pay your bill, you crazy person? I bet you did something else. We're not going to say that because we've all been there. We've all been there. And so there's no judgment. It's like, when I was there, I feel you. And here's how I tried to get past that. And here's some services that may help you. So it sometimes is a better cycle to go 211 first and then a referral back to the church if we can't help them or can't help them in full. But we really want to try to get to the root cause of some of these challenges.
That's a great point. April, you want to add anything before I jump to the last question?
No, we're running low on time, so I'll let you go ahead and ask the last question.
Okay, well, the last question is, do you have any parting thoughts you'd like to share with anyone watching of maybe something that we didn't talk about but should have?
The only other thing that I would like to get out is that poster that I sent you so that people know when it's appropriate to call 911 versus the new 988 line. And then, that they can call 211 for everything else that doesn't require one of those two numbers.
Great. It is up on our screen, and we will share that information after the fact in the comments below as well.
Thank you. Yes, people need to know that, yes, 911 is there 24/7 for any of their immediate medical needs. If there's any sort of violent situation going on, some sort of disaster, you see a drunk driver on the road, yes, that's completely appropriate. 988 is a wonderful new suicide and crisis lifeline that's out there. So anyone who is having suicidal thoughts or any sort of crisis like that could be directly out to them. And you can call 211 anytime for any reason. And so even if it is a 988 call or a 911 call, we can transfer you over there. But if it's not, we can help with everything else. Call us with any of your housing needs, food needs, transportation, legal issues. We'll help get you connected with all of those resources.
Great. Thank you, April. Margaret, anything we haven't covered you want to share?
I think the only thing I would say, and I would love to tell you that we're perfect, but we're not. And so as the United Ways have governed this line now for, just over 2.5 years, we value your input. And so if you have used 211 or you want to use 211 or it didn't work out perfect or you had a challenge, that's equally important for us to know. And so please, don't hesitate to share your experiences, either good or bad, because we want to make West Virginia 211 the best 211 in the country. And the only way to do that is to identify any challenges we have internally and to make sure that we fix them. So if something happens and you're like, man, that didn't happen exactly the way she said it was going to. Kelly has all of our contact information. You can find us on Facebook. You can find us anywhere you are using your smartphone or your smart device, but reach out to us and say, what, can you just check? I called this time and it didn't work. We're always going to ask what your phone provider is, because sometimes that matters to the way the process works, but that's really what we're going to care about. And then we're going to try to look back and make sure that if it was an operator training thing that needs to happen, that we're going to get with that operator and retrain them, or if it's a system challenge that we want to fix the system. So please let us know if there is a challenge or you hear about one, because we always want to try to make it better.
Thank you, Margaret. And I'll say again, before I say thanks and we leave, that I am convinced, Think Kids is convinced, one of the most important things that we need to do is centralize our resources and make it one-stop shopping. So if people need to know where something is, they go to one place and then they can find this information, because one of the things that we're really doing is losing people who go on this search for resources that they cannot find. It can be really deflating. It can be very frustrating for them. It makes much more sense for us to all kind of swim in the same direction, find one centralized resource and really make it the best that we can. And so we are really lucky to have 211 in the state, and hope that more people will spread the word of the great resource that it is. We are always kind of, stressed for resources. We have some overwhelming need. but that's where to go to really start your journey. So I really appreciate your time, Margaret and April, today. For those who joined us, if you have any additional questions or comments for those who will be watching this after the fact, you are welcome to email us at kelly@thinkkidswb.org. We'll get you connected with Margaret and April. And as always, you're welcome to post any questions or comments, and we will get to them after the fact. So thanks again, everyone, and have a great weekend.
Thanks, Kelly. Appreciate you so much.
Bye-bye.